Welcome to Virginia Currents. I'm Amy Lacey. The coronavirus has created an unprecedented health crisis across the globe, including here in Virginia. But healthcare workers remain on the front lines of the fight, taking care of patients and putting their own bodies, minds, and spirits at risk. We talked with nurses at Bon Secours St. Mary's Hospital in Henrico County about how they step up to the challenge when their community needs them the most.
You name the emotion, I think everybody's had it, and it changes daily.
Working the ER pretty much is controlled chaos. You have to think fast and move even faster. People just don't know what we go through sometimes.
We have seen the most severe critical cases, and we have seen some rather simple cases that we've been able to handle and discharge easily. And I think it still varies from patient to patient, depending on, of course, do they already have heart issues? Do they already have lung issues? Do they already have diabetes or high blood pressure? Can they handle the treatment from the machines that we're giving them, or does that stress everything else out as well?
Some don't get better and some do really well and they leave the ICU, and those successes are really great, but the ones who we give everything to and they still don't survive is hard.
I've definitely seen a lot of people that have recovered, but then I've also seen people who are relatively young get up, go to the bathroom, come back, be unresponsive, and then be intubated. Somebody who you wouldn't even think, they might have some comorbidities, but you just don't know how it's going to affect you.
I caught COVID, unfortunately. It was very difficult to be isolated. I missed 34 days from work. So I worked from 7:30 at night to 8 o'clock in the morning on Fridays, Saturdays, and Sundays. I was sitting at the charge nurse station. I was doing charge that night, and I had a tickle in my throat. And that was 2 o'clock in the morning. So by 8 o'clock that morning, I started having chest pains, and I was really starting to feel run down. So I went home, got into bed, and by 2 o'clock that evening, I couldn't get out of bed. But I did have some really bad night sweats. I also had shortness of breath, where I had to do what we call tripoding, put my hands on my knees and take deep breaths, in order to get up and down stairs. 2 days or so of diarrhea, so it was pretty traumatic, to say. It does take a toll on you mentally. Yeah, it does. I mean, I was scared. I didn't tell my mom, and I think a big part was it just lasted for so long. I just wasn't getting better, and that's the scary part, It was early with COVID, and the unknown was scary. And even now, we still don't know the long-term effects that it's going to have. I become short of breath so much more easily now, so I've not been back on my bicycle. I just hope to God that they never have to deal with it, If you choose not to wear a mask, you have to remember you're not wearing a mask to save your life. You're wearing a mask so that the next person don't get infected.
So all little nodules and so forth would let us know the air is not getting in and out smoothly. The lungs tend to almost like swell, and then they won't allow the air to get in them at all, and therefore the oxygen cannot get in, or the carbon dioxide cannot get back out. Patients in distress, the alarms. Of course, not having the proper oxygen just puts stress on every other part of your body.
How are you doing on your stomach?
When you're laying on your belly flat, that's prone position, so we call it proning the patient. But that helps, almost kind of like gravity, just get off the lungs and let the opposite side of the lungs be able to move, the back side be able to move up and down easier while they're on their belly. So the patients that are on the ventilators that we have sedated so they are unconscious, we will put them on their belly for 16 hours and then we'll flip them back over for 8 hours. Put them back on their belly for 16 hours, and that has been promising. And it's really been helping the people that can do it before they get too sick, so they don't end up on the ventilator.
Perfect numbers.
A new normal. It is a new normal. just how you get home from work and you take all your scrubs off outside and leave your shoes out and immediately go take a shower.
Just more cautious when you go places, which everybody's being more cautious now, but when people find out you're a bedside nurse that works with COVID patients, I guess other people don't really understand what precautions we're taking and you're monitoring your symptoms, but you do feel kind of more cautious.
Typically, you can get everything on in less than a minute. You want to make sure your front and your back is covered. Put on your N95. You want one strap on the crown of your head and one strap down below. You squeeze in the nose tab, and it protects you against both airborne and droplet. I'll put on my surgical cap. You need a face shield. If you don't wear glasses, a lot of people opt to wear goggles.
Does it get all steamy?
Yes, it does. It gets steamy and hot. So we're going to glove up. I threw away the stethoscope. Don't want to go in and out of the room. So it's important that you have communication to people who are outside. Bring me blood cultures. That can bring you things that you may need. You would not leave this room until basically all of your orders are done. So you could actually be in here 40 minutes or so.
We see the sickest of the sick. They're critically ill when they get to us, and we stabilize them, the best that we can, and they usually stay for a couple of weeks to a couple of months. It's lonely being a patient in the ICU.
The day of our nurse is just so busy. You only have but so much time to actually sit down and talk with them.
They can't even really see us. So you have the mask on, the face shield, the gown, the gloves, and then some of our negative pressure rooms are so loud they can't even hear you. They can't see you smile to reassure them of anything. I'm sure it's terrifying. You try to do Zoom calls or have their family members on the phone, and if they aren't able to talk back, if they're on the ventilator or whatever, we'll hold the phones up or the tablet up so they can hear their family members.
And the extra burden of perhaps being the last one with them before they pass away.
Yeah.
That's always
rough. Really hard. And their family can't, families sometimes live far away. A Zoom call when you know that somebody's about to pass, it's not enough.
Yeah, it's not.
It's hard being somebody's family member and in their last days.
I think that this pandemic and the stuff that we're all going through is definitely going to leave a lasting mark on all of us.
How do you cope?
Try to do some self-care things, working out, trying to eat healthy.
I have a really supportive family. My brother also is a nurse in the ICU, so that's helpful. I have a 15-month-old, so he keeps me pretty busy.
Talking with coworkers, because then you can kind of release those kind of frustrations, kind of process it through with them, because they've had the shared experience.
We're definitely closer. I feel like we lean on each other a lot. We don't let each other drown.
You have to know it's okay to cry. You have to know when to pull it together, though. It's part of what we do. And you try to keep it at a distance so you don't think about it and just cry constantly. But it also shows you how many nurses and therapists care for their patients. Doctors too. Doctors will be there and they're crying. So, sorry. It's just a part of being in the healthcare. Okay.
I admire you.
But it's not just me, it's all of us,
Being an ER nurse, or being a nurse in general, you learn to grieve, but you learn to grieve quickly because you have a job to do. And it's a rough job. It's a rough job. And you can't save everybody. And you just have to move on from the person that you were not able to save and concentrate on the ones that you can save. Sometimes you see people and they recognize you and they say, "You saved my father's life," and they're truly, truly grateful. And and they're the ones that keep you coming back.
Thank you for your service. I mean, we say that to the military, but healthcare workers are our frontline heroes.
Thank you.
It is nice when you get somebody off the ventilator and they smile and say thank you and they get discharged. Those good days keep you going.
It feels like a calling, like you need to come back to take care of these people, because if you don't, who's going to? There's such a nursing shortage that, you know, we're already short-staffed, so your teammates need you to come into work to take care of these people.
It's these people, not just with COVID, but it's these people's darkest days. They are at their most vulnerable, and you know, we're here to help them through that and get them better and get them out and get them back home to their lives. And that is rewarding.
St. Mary's Hospital just wrapped their involvement in a double-blind placebo-controlled study on nitric oxide. This compound was effective in treating the coronavirus that caused the 2003 SARS epidemic, which is closely related to the virus behind COVID-19.